Anong gagawin mo kung nag-Ehrlichia positive ang aso? It can be scary, kakatakot naman talaga, and confusing to get an Ehrlichia positive result from your dog's visit to the vet. So, because of this, I'd like to discuss and go over what positive results on these tests mean and what we, Dr. Animal Wellness Centers, recommend doing about them. This video will focus on ehrlichiosis, ang pambansang sakit ng aso natin dito sa Pilipinas. So, stay tuned. Welcome back, guys. My name is Dr. Tresho, and every week we post videos, cases, topics, and tips on how to better take care of your fur babies. And this week, we are going to talk about the pambansang sakit ng mga aso natin dito sa Pilipinas, ehrlichiosis. But before we proceed, please hit like, subscribe, and the bell button so that you get updated for whenever we post new videos in this YouTube channel. We are on Facebook, Dr. Animal Wellness Center, and do follow us there. And we're also on Instagram, Dr. Animal Wellness Center, and my personal Instagram, Tresho. So, paano ko nakatanggap ka ng positive results? The first thing that you need to do, don't panic. So, a positive Ehrlichia test does not necessarily mean your dog has an active infection right now. Hindi ibig sabihin, may sakit na siya and kailangan na natin siya agad gamutin. It doesn't mean that way. It means that at some point, your dog has been exposed to the Ehrlichia organism and produce antibodies. Kasi minimeasure ng mga tests are antibodies, no? The test does not tell us if the exposure was recent or in the past or whether your dog needs treatment. So, i-explain natin. So, kasi nga, kapag na-expose ang aso natin sa isang organism like Ehrlichia, halimbawa, the body will launch an immune response to that and form antibodies. Yun yung papatay dun sa Ehrlichia. No? So that also the body will remember the next time to get exposed to it, alam niya na yung gagawin. Ang minimeasure ng ating mga test are yung antibodies. So, hindi yung antibodies, hindi niya alam kung bago lang ba ito or matagal na. Lalo na kung may previous history, may history yung aso niya ng previous exposure sa Ehrlichia at ginamot niya na may antibodies na siya dyan. Definitely. So the organism lives inside the white blood cells of the dog. So, ito yung sila yung umaatake dito sa mga organisms na ito. And it can remain there for months without causing any clinical symptoms in the dog. Dogs with a healthy immune response will make antibodies against the organism and kill it, resulting in no clinical disease. Walang sakit, pero meron siyang antibodies. No? How do we tell the difference between those who need treatment from those who do not? We use a combination of assessing whether your dog is currently showing symptoms. May symptoms ba siya ngayon? And additional blood testing. A small percentage of dogs exposed to Ehrlichia will become clinically sick, magkakasakit. Pero yung the rest may successfully fight the bacteria off and show no or very mild clinical signs of Ehrlichia, which include lethargy, high fever, loss of appetite, walang gana kumain, no? Nananamlay o kaya nananakit yung mga joints, kasukasuan, and enlarged lymph nodes, yung mga kulani, lumalaki, napapalpate na yan. Some dogs may appear to recover from their symptoms, pero they will enter into a chronic state of disease in which the organism damages blood cells with several potential serious complications. Kala mo gumaling na, pero nandun pala sila sa katawan ng aso mo. And we will discuss this story. So what are the signs of ehrlichiosis? Signs of ehrlichiosis can be divided into three stages. The acute or the early stage, the subclinical, to which signs of the disease are apparent, nakikita mo, and the clinical or yung chronic long-standing infection. Ayun yung nasa katawan na nila. In areas where ehrlichiosis is common, many dogs are seen during acute phase. In this stage, infected dogs may have meron siyang fever, swollen lymph nodes, respiratory distress, weight loss, bleeding disorders. Ano yung bleeding disorders na yan? Yung nagdudugo bigla yung ilong, minsan umiihi na may dugo o tumatay o dumudumi na may dugo. No? Ito yung spontaneous hemorrhage or spontaneous bleeding, para siyang may dengue. And occasionally, neurological disturbances. They may seem unsteady or develop meningitis kasi parang pag-gewang-gewang sila. Parang, differential natin dyan, probably is rabies pa nga eh. This stage may last 2 to 4 weeks, and some dogs may eliminate the infection or head into the subclinical phase. The subclinical phase represents the stage of infection in which the organism is present na infection, but hindi siya nagkukos ng outward signs of the disease. Sometimes, a dog will pass through the acute phase without its owner showing, or yung may-ari hindi aware of the infection. Kasi masyadong mabilis lang, o kaya nawala yung owner, pagbalik niya, gumaling na. No? These dogs, so nag-enter na siya agad sa subacute phase. These dogs may become subclinical and develop changes observed at the laboratory level. Makikita mo lang kapag nagpa-blood test na. Pero walang apparent signs of illness. Parang healthy pa rin siya. No? The subclinical phase is often considered the worst phase. The worst phase because there are no clinical signs and therefore the disease goes undetected. Underground siya. Naninira na siya sa loob. The only hint that the dog may be infected during this phase may be after a blood sample is drawn, or when the dog shows prolonged bleeding from a puncture site, or bigla na lang magdugo yung ilong niya. No? Dogs that are infected subclinically may eliminate the organism or may progress to the next stage. Clinical ehrlichiosis occurs because the immune system is not able to eliminate the organism. Kumbaga, nakapag-launch siya ng immune response, however, tuloy natalo yung katawan. No? Nagwagi yung Ehrlichia. So dogs are likely to develop a host of problems like anemia, bleeding episodes, lameness, pamimilay, no? Sometimes eye problems including hemorrhage in the eyes or sometimes blindness. No? Minsan magkakaroon ng petechial hemorrhages in the eyes. Also, neurological problems and swollen limbs and inflamed lymph nodes. If the bone marrow or the site of blood cell production fails, the dog becomes unable to manufacture any of the blood cells necessary to sustain life. Ayan yung mga red blood cells, white blood cells, and yung platelets. Yung platelets, usually, yung tinitignan natin. Bakit may anemia? Bakit may thrombocytopenia? Ayan yung nakikita natin. Ayun yung tinitignan namin mga veterinary. Testing for ehrlichiosis include antibody testing, which we detect the antibodies, no, against the organism in the blood. Yung antibodies, ayun yung kit, ayun yung tinetest natin doon. Antibodies will typically appear 7 days after infection. In office screening, tests can have false positive results. Ito yung false positive. Nag-positive sa test pero wala naman talaga siyang ehrlichiosis, but meron siyang antibodies. No? So the dog testing positive should have, kung nag-positive doon sa test, ang next na gagawin natin is to check for PCR to determine whether Ehrlichia is actually present. So if the PCR is negative, hindi natin kailangan ng treatment unless the dog is clearly symptomatic. So pag nagkumuha tayo ng dugo, tinest natin yung dugo sa kit, nag-positive, i-confirm, at wala naman siyang clinical signs o wala, asymptomatic siya, i-confirm natin sa PCR. Pag nag-positive sa PCR, kailangan natin siyang gamutin. Kapag negative, hindi natin kailangan gamutin. No? Kasi nga, meron siyang antibodies. Ito na yung next question. If most dogs do not get sick from exposure to Ehrlichia, and a positive test doesn't necessarily mean a dog needs treatment. So, why do we need to care about a positive results? Eh ano ngayon kung mag-positive siya pala? No? May mga reasons. Kasi number 1, Ehrlichia can progress to a chronic phase where dogs don't appear sick, but the organism is damaging blood cells and can trigger serious inflammation in the eyes, brain, or kidneys. Number 2, evidence of exposure to Ehrlichia tells us whether preventative measures such as yung tick control natin, yung tick control products natin, have been effective. Kung wala man, dapat meron na siguro. You need to rethink about these things. No? Especially sa atin sa Pilipinas, napakadami nating garapata. devoted YouTube video. Ayan, check nyo itong YouTube videos. I actually have two. You can check kung ang effects ng garapata, pulgas garapata, at saka yung mga available products na laging tinatanong sa akin kung ano yung mga available products that we can use for our dogs in case they have ticks. No? So number 3, bakit nga ba natin ginagamot? Bakit natin kailangang malaman at i-test? Because your dog's exposure to Ehrlichia reminds you that you need to be careful too. Kailangan maging maingat ka rin since most of us are spending time in the same places our dogs are. They may be important sentinels for our own risk of exposure to other tick-borne diseases, especially yan sa mga ibang bansa. So, after all that, what do we actually do if a dog tests positive? Na-discuss na natin pahapyaw kanina, but we'll clarify it again. So for a dog with a positive test but no clinical signs of Ehrlichia, we recommend a test called complete blood count such as CBC, which looks at the numbers of the red and white blood cells and the clot in the blood called platelets, no, the ones that causes the blood clotting, no, kapag nasugatan tayo, sila yung pupunta doon para itigil yung pagdurugo. So a low platelet count called thrombocytopenia, lagi niyo naririnig, and anemia or low red blood cell counts, and a high level of protein globulin in the blood may be found. Kapag nakita niyo yan, thrombocytopenia, anemia, and hyperglobulinemia, yan, malamang meron niyang Ehrlichiosis. So if the CBC is normal, no further action is needed. If any of those cells are abnormally low, we treat your dog with an antibiotic called doxycycline for 30 days and then recheck the CBC every now and then. No? Usually mga 2 to 3 times. Even more sometimes kung hindi pa bumababa or hindi pa tumataas yung platelets. No? It is important to know that doxycycline commonly causes nausea, pagkahilo, vomiting sometimes, no? Kasi medyo mainit siya sa lalamunan. So doxycycline should not be given with dairy products. Kasi yung calcium will bind the drug and rendering it useless. No? It also shouldn't be given together with iron supplements. So kung doxy sa umaga, iron supplements sa gabi. And make sure to follow it up with food or water as madali kapag binigay mo yan, especially yung tablets, no, it gets stuck dun sa throat at nag-iinit yan, can cause ulcerations sa throat. Dogs experiencing severe anemia or bleeding problems may require a blood transfusion. Severe anemia and bleeding problems, no? However, this does nothing to treat the underlying cause. Kapag nagsalin tayo ng dugo, nandun pa rin yung Ehrlichia, no? Wala siyang ginagawa dun sa sakit. Pero because severe anemia will lead to hypotension and even death, kailangan natin minsan magsalin ng dugo. And meron kami tinitingnan ng levels ng RBCs and hematocrit levels para malaman natin kung kailan tayo magta-transfuse ng blood. Alright? So for a dog with symptoms of Ehrlichia and a positive test, we treat the doxycycline for 30 days. Plus pain relievers as needed, of course. Yeah. Typically, we see an improvement in symptoms within 1 to 3 days once starting treatment. Pag nag-umpisa tayo ng gamutan, makikita mo mag-iiba na agad yung tsura. We also recommend monitoring CBCs as noted above every now and then. No? So, eto, lagi tinatanong, na-diagnose ang aso mo, nag-umpisa na tayo ng gamutan. Next question, Doc, magkaka-Ehrlichia ba ako? Makakakuha ba ako ng Ehrlichia from my dog? The answer to that is a resounding no. No, you cannot. However, humans can get canine ehrlichiosis from tick bites. Kung makagat ka ng kung makagat ka ng ticks na yon. So the disease is only transmitted through the bites of ticks. Kung meron ng Ehrlichia yung aso mo, kahit yapusin mo yung aso mo, kasama mo sa pagtulog, hindi ka magkakaroon ng Ehrlichia. Magkakaroon ka lang ng Ehrlichia kung yung ticks na nakakagat sa kanya in the past, tapos yung same tick yung kakagat sa'yo, that's when you get it, no? The disease is only transmitted through the bites of ticks. Therefore, even though the disease is not transmitted directly from dogs to humans, infected dogs serve as sentinels or warnings to indicate the presence of infected ticks in the area. Ibig sabihin, doon sa ginagalawan mong lugar, ginagalawan ng aso mo, kung saan niya nakuha yung Ehrlichia, naandun sila. So, kailangan mo mag-ingat. Kailangan nating tanggalin yung mga ticks doon. Yung Ehrlichia, walang vaccines. No vaccines are available for this disease. Keeping ticks off your dog is your best defense. Please do this as naturally as possible and as religiously as possible. Your dog's healthy immune system can keep this disease from becoming clinically manifested. So I hope this video has demystified a positive Ehrlichia test and explained why we have added them to your dog's yearly heartworm test. We want you to enjoy the great outdoors with your dogs, but keep them safe as well. So if you have questions about our topic for today, yung Ehrlichia, please come and visit any of our Dogfords Animal Wellness Centers in Timog, UP Town, North EDSA, and here are the numbers to dial. So if you live in Cavite area, we have a clinic in Silang along Aguinaldo Highway. It's called Wags and Whiskers, and you may reach them through these numbers. Or you may check our website by typing www.dogfordsawc.com for further information. This has been your friendly neighborhood vet, Doc Fords Ratio. See you again next week. But before we proceed, please hit like, subscribe, and the bell button so that you get updated for whenever we post new videos on this YouTube. Sapa. Game. But before we proceed, please hit like, subscribe, and the bell button so that you get updated. Hapon na ako. Hinahamon na ako sa sarili.